Before we start, I'd like to share a story with you. Imagine you've worked so hard. You put in the hours, you sacrifice your weekend just for the SE exam. When the results come in, you see 69. Not what you expected. Not enough to pass, not enough to move forward. And your heart sinks. And you reread it, thinking or hoping that it is a mistake, but it's not. It's just 69. And this is a real story of Dr. Lawrence Appleton, who failed SCA on his first attempt.
When I did reach out to you, I had only about a month. So one of the things I remember asking you was whether I'll pass. And I mean, I was grateful with the feedback and the confidence you instilled in me that if I did apply myself to the program, I would pass.
Fast forward 4 weeks later, he passed his exam with a score of 87.
It was painful. I wouldn't want any of my colleagues to go through, but then I'm happy I've been able to cross this hurdle.
The point of this story is to show you that regardless of your past, success is within reach. You can pass this exam as well. If you're new here, my name is Dr. Erwin Kwun. I'm a GP and a medical educator. I'm on a mission to help doctors lead a fulfilling life. I'm a big advocate of coaching. I've benefited a lot of coaching myself, and it has allowed me to find breakthrough in my career. And this is why I use coaching in my teaching, and the coaching has helped other IMGs to find breakthrough in their career. So I completed my MLC GP back in 2021. I passed the RCA first attempt, and since then, I've helped over 300 GP trainees to achieve their goals. It's going to be interactive today. You're going to learn a lot, and you're also going to get a free gift at the end, and there'll be a special offer. And even if you don't want to take the special offer, you'll still learn a lot today. And there'll be opportunity to ask questions, and I'll be answering your question today. Because I know there's a lot of misconception, a lot of things being told about the SCA, but it's very important to know where you're getting your information from. So the aim of the teaching today is to introduce you to the SCA, understand the format and what is being tested. You're going to learn about the challenges and the pitfalls, and I'm going to teach you how to prepare, because if you just wing this exam, then there's a good chance you might not pass. So you better have a good plan, and I'm going to show you how to do that. So I also did a poll about what are the things that you're struggling, and most of you are struggling with time management. Some people are also struggling with not getting adequate feedback, and we're going to dive into the time management, as Suresh also mentioned. That's one of the things. What do you think is a pass rate for SCA? Write in the chat which one do you think is the right number here. So what's interesting about the SCA is that the pass rate has varied. In September, it was 68. In October, it was around 66. And then November, the last sitting that was reported was 68. So the pass rate varies around 67, 68, which means that 1 in 3 candidates don't pass the exam. So it's very important that you realize that the pass rate for SCA is not as good as the RCA exam. So you have to take it very seriously. So let's break down some myth. There's a lot of myth around this exam, and it's important to understand what you're being tested on. One of the things I've heard is that, oh, this is just a test of my communication. That's not true. And I'll show you why that's not true. The SCA exam, the cases that you're going to have are mapped based on the 12 clinical experience groups. So it's not just about how you're communicating, but you also need to know whether you have got enough experience in each of these 12 clinical experience groups. Commonly, among the GP trainees I help and coach, a lot of male GP trainees struggle with gender reproductive, and possibly that's probably because you're not getting enough of these cases in their own practice. Or I've noticed some GP trainees struggle with follow-up when you're having to discuss results because they don't have a good structure. So let's go through a case scenario. You've got a patient who's 50 years old, and you're given this case vignette. One of the most important thing about the SC exam is how do you prime your case? You know, time management is a big problem. And the most important thing I've noticed among the top scorers is that they prime their case very well. You know, before you start the consultation, you already lay the groundwork. So let's say we're going to prime this case. Okay. I'll give you 3 minutes to prime this case. And let's go over what are the things that you need to be thinking. You have to play the consultation in your mind. Right now, we've got information about the case. So you can already anticipate what do you think this case is going to be about. You've got some clues as well here. This patient is 50 years old, right? So write in the chat, what do you think might this be? It's very important to anticipate. Yeah, great. So HRT, menopause, COPD, uncontrolled hypertension. Yeah, it could be HRT. Yeah, most of you are thinking it could be HRT, right? So that could be a case of HRT or menopause, which would be a good case for an examiner to test your knowledge on whether you've got enough knowledge and are competent to do that. So let's say it is HRT. So then you have to anticipate what are the things that you need to discuss. What are the issues that might present? And don't just think about the issues, what are the questions you might ask. Also consider what are the solutions. How are you going to discuss if it is HRT? Okay, so you see how it's really important to prime your case. So write down a few questions you might ask and what are the things that's going in your mind right now. Yeah, so Dr. Himanshu said menopausal symptom, when was the last period? It's very important to know. So you're allowed to use a whiteboard, and I encourage you to use your whiteboard before the exam. One of the trainees actually mentioned to me that he wasn't using his whiteboard at all. And then on the day of the exam, when he used it, he realized that his marker wasn't working. That's the worst time when you realize your marker is not working. So make sure you condition yourself to use your whiteboard, the marker, and make it as likely as possible as the exam condition. So you condition yourself. So you want to explore the menopause symptoms, explore the patient's idea, concern, expectation. You also want to check whether it is suitable for this woman to go on HRT. So question to check the suitability, any contraindication like history of DVT, PE, or cancer. And exploring the psychosocial situation and occupation as well. So it's not just a medical case. In the SCA, there's always other things coming up. So the situation, it could be that the patient has got a problem in their life or with their work, it's causing stress. They're having hot flushes and it's affecting their work. So you need to be thinking about all these aspects. So when you take a history, the history needs to be focused. You have to take a targeted history about the menopause symptoms, gynae history. Also, you consider various differentials to make a safe assessment. So the patient has got hot flushes. You have to be thinking whether it could be something related with thyroid problems as well. So don't just narrow down thinking, oh, it's menopause. And as we discussed, checking the suitability, then you need to make sure that you get the patient's health agenda. And when you ask it in context. Sometimes I can see people just go through a checklist, and that's not how you should be doing it because you're not going to be marked very well for relating to others. It should be uncovered naturally as the conversation unfolds. With regards to the cues, it's so important that you don't miss cues. If a patient drops a cue, make sure that you follow up the cue. Don't leave it to later because chances are you're going to miss a big piece of the puzzle. Then once you discuss what you think it is and you get shared understanding with the patient, you can go into the shared management plan discussing about the HRT, lifestyle changes as well. It might be relevant. And you need to discuss the risks, the pros and cons. So as you can see, it's not just communication. You need to know this and you need to have done this before. Otherwise, if it's the first time you're going to do this, it's going to show that you're not really at ease with this. Okay. And also discussion about follow-up as well and safety netting advice. So let me ask you a question. Let's say you decide to start Linda on HRT. Which one will you prescribe?
It depends on the other comorbid things also. Like,
Yes.
yeah, we need to ask many questions before we decide. Like,
So yeah, you
yeah,
have to assess what is it that you're going to treat for. For example, first of all, we need to know whether this woman has a uterus or not. So if the woman has a uterus, then it's a combination of estrogen and progesterone. If the woman doesn't have a uterus, it's estrogen only. So you got a good point. The next question is this woman perimenopausal or postmenopausal? So when was the last menstrual period? So if a woman is perimenopausal, then the method of HRT would usually be cyclical. And you've got a choice of oral or transdermal. And in shared decision making, this is where you can discuss the pros and cons and let the woman decide which one will be most suitable. Remember, transdermal one, it has a slightly lower risk of DVT. If the woman is postmenopausal, then the method of choice would be continuous combined. And if we're going for oral, the first line is ClearFem. If it's transdermal, then it's Everell Conti patch. Is this clear so far? Yeah. Okay. Great. So as you can see, if you have already thought through the issues, the questions to ask, how you're going to manage it, then the 12 minutes that's going to be allowed for you to consult, you're going to use it effectively. You're not going to ask questions that might not progress the consultation. So the consultation starts before you actually start it. It starts in your mind. All right. The second myth is practice makes perfect. Who here has ever been told practice makes perfect? This is something that many trainees tell me, like, oh, I just need to practice, practice. And it's not true. I'll show you why it's not true. Meet Dr. Inamuna Berega. He was stuck in training for 4 years. He failed his exam and had to resit it, and it delayed his CCT. And it wasn't because he was not practicing. In fact, he was practicing a lot. And the problem was he was practicing and he was not working on the right things. And it just consolidated bad habits. Let me ask you a question. What do you think is a pass rate among IMGs? Write in the chat, what do you think is a pass rate? Okay, so most of you are quite pessimistic. You're saying 49, the lowest one. Actually, the pass rate for IMGs from the SCA performance report was 51%. So essentially, 1 in 2 IMGs are not passing the SCA exam the first attempt. And that's a stark contrast compared to UK graduates. Okay. So as you can see, the odd was not in the favor of Dr. Inamuna Berega. With 1 in 2 IMGs failing SCA, you can feel like this exam is rigged or like you're not going to pass because of your background. But there are ways to pass this exam. And it's quite easy to feel discouraged. But first, you have to believe you can pass this exam. And Dr. Inamuna did not lose hope, despite going through depression and having a lot of problems. Imagine the consequences of failing an exam, having to rack up 5 grand in exam fees, your confidence at rock bottom, and you carry on the line. You know, when you've already sat 4 times, it's very exceptionally that the college would grant you a fifth attempt. And not only this, but you also have the loss of earning. You know, there's a lot of GP trainees who are stuck in training when they could actually graduate and qualify and start earning much more. And every year that Dr. Inamuna was stuck in training, he was losing 50 grand compared to a GP partner. So the problem with Dr. Inamuna's practice wasn't that he wasn't practicing enough. He was practicing, but he was just practicing blindly. And he wasn't working on the right things. And that was the issue. So instead of just practicing, and practicing, what you have to do is follow this step-by-step process. Practice, reflect, seek feedback, make adjustment, and implement. And when I spoke with Dr. Inamuna, a big gap in his preparation was he was not getting constructive feedback. And once we fix that, he passed his exam and he's now qualified as a GP. And this is after he passed, we met. I've actually done a video of his case study. You can go and watch it if you want to. And this has inspired many other trainees who felt like they couldn't pass an exam. You have to work on your mindset first. You have to believe that you can do it. But don't just practice. Practice doesn't make perfect. It just makes what you're doing permanent. Okay? Now let's break down another myth. Shared decision making is just giving options. I've heard that many times as well. I don't know where people are learning this, but the problem is you're not supposed to be just sharing options and giving options. That's not shared decision making. What you need to do first is achieve shared understanding. And so many trainees don't understand this. They just skip this. And instead of making the decision with the patient, they're making the decision for the patient. Or sometimes what I've seen is they don't take any ownership of the responsibility and let the patient decide. But then the patient doesn't know which one to choose because there are too many options. Have you noticed this in your group?
Sorry.
Have you noticed in your group that there are people, when they come to decision making, they're just sharing too many options?
Yeah, but they will give one by one, but not everything together. It will be overwhelming for the patient.
Yeah.
Yeah.
Sometimes people just give option, but the option is not the right option for the patient. And that doesn't show that you're using your medical expertise well. So instead of just giving options, what your job is to meet the patient where they are at and explain what's going on in your mind and readdress the patient's ideas, concern, expectation. Once you and the patient are on the same page, then you can explain what you think might be a good option for them. And if they don't, let's say, for example, they decline that, then you can provide an alternative option. Okay. So it's very important that you don't confuse shared decision making with just sharing options. What you should be doing is sharing the discussion with your patient, involving them. And that's where you both make a decision together. The patient, they're actually coming to you so that they can get your professional opinion. But if, for example, I'm in consultation, I just tell the patient, Okay, so you got a headache. What we can do is we can treat you with some medication. There is paracetamol, ibuprofen, or cocodamol. Which one would you like to take? It's not good, like, because as a doctor, the patient is expecting you to use your professional judgment to offer the best option for them. And then a better way would be explaining the patient, I can see you've been having this very bad headache. And the thing is, I can see that you've got asthma. So I would not recommend ibuprofen, but paracetamol would be a better option for you to take. Cocodamol is another medication that some people do find useful, but at this stage, I would not recommend taking something stronger. So, like, this is very nuanced. Does this make sense so far? Okay. So normally what I've noticed when I coach trainees is that they tend to do it in a way like lifestyle option, medical option, and they don't really integrate what they understood from the patient. So for example, if a patient is very busy and you're trying to recommend the patient lifestyle option to exercise half an hour every day, it might not be realistic. So you have to explain it in a way that's going to fit to the patient's lifestyle preferences. So you might say, I know you're very busy. What I would suggest, if you could, is try and do 5 minutes every day. Even if you're at home, just 5 minutes of exercise, and then gradually you can build it up. Do you think that's possible? See, that's a much better discussion you're having with the patient rather than just telling the patient you have to exercise half an hour every day. Okay. So I hope you understand the difference here. Now, let's talk about the SCA. So this is an exam that you sit in your ST3 year, and the exam fee is £1,180. So normally you have to reserve it early, and it's very important that you decide which date that you're going to sit the exam, which month, so you can plan ahead. So you're going to have 12 cases, and it's divided into two. So you have 6 cases, comfort break of 10 minutes, and then 6 more cases. From speaking with trainees who've gone through this process, what they say is that it's quite exhausting to go from one case after the other. So you have to realize that it's going to be a quite big day for you, and also the stress as well. So that's where preparation is key. So what's the purpose of the exam? The purpose is the examiners want to see how do you keep your patients safe? Are you adaptable in treating different types of patients and illnesses? So there could be patient with other issues like learning disability or have vulnerability where it might be requiring you to adapt your communication. The examiners are also looking at how do you manage risk, medical complexity, and uncertainty. It's also really big on your behavior, your attitudes, and your concern. Most people, they focus only on the skill set, but they don't think about the behavior. Are you saying something, but you don't mean it? Because it's going to be incongruent. So the behavior needs to be in alignment to what you're doing. So when are you planning to sit the exam?
Sorry, doctor.
Yeah.
What do you mean by the behavior and like how do you show that like is attitude in during the SCA exam?
So good question. Like commonly what happens is that when people are going through an exam, they're a bit stressed about the exam, about missing something, and they're rushing it. So if a patient says, for example, I'm worried about whether it could be something more serious, doctor. And if you don't really show that you empathize and acknowledge it, but you just say, oh, I understand that. So what were you hoping? See, like it's not congruent. Whereas if I said, I can see you're a bit worried. Tell me more. In what way are you worried? And what exactly are you worried? See, like I'm showing more interest. The behavior is congruent in what I'm saying. Whereas if I just say, oh, okay, right, what are you hoping from? Like, it shows like I'm a bit formulaic. Do you see the difference? Okay, I hope that's clear. So when are you planning to sit your exam? Anybody sitting next week? Or are you sitting further later? Write down in the chat when you're planning to sit it. Okay, I'm sitting in May, so you have enough time. June. Okay, I can see Dr. Himanshu is sitting in on 6th February, so there's not a lot of time. Okay, so if you're planning sit it in May or June, then now is a good time to look at how you're going to plan it. Okay, and then thinking about study group as well, other people that you're going to practice with. So let's talk about the marking. So the marking is on 3 different domains: data gathering and diagnosis, clinical management and medical complexity, and the last one is relating to others. The vast majority of trainees struggle with clinical management, and relating to others is another domain that many IMGs struggle with. I think data gathering, most trainees are quite good because you've been trained to do it from med school. Now, let's look at the weighing. Data gathering and diagnosis is equally weighted to the relating to others, whereas clinical management and medical complexity is where you get more marks. So in clinical management, medical complexity, it's multiplied by 1.5 times. So there are 4 grades from clear fail to clear pass. So clear fail, where it's clearly that it's below standard, potentially dangerous. Fail is where maybe you did not show the evidence sufficiently for a pass. And this is where exam techniques comes in. You know, the SE exam, you have to demonstrate it in a way that the examiner is convinced that you're safe for independent practice. But if you don't show it, or if you think they can read your mind, then you're not going to pass. Pass is where you show that you are at the level of an independent GP, newly qualified. And clear pass is when you have shown that you're doing way above what a newly qualified independent GP is doing. So we've gone through the introduction of the SCA, the format of the exam and what it entails. Next, we're going to look at the challenges and pitfall. So what's the reason do you think that trainees don't pass this exam? I'm curious to know, what do you think? Write down in the chat. So if you had to say one reason why you think some trainees are failing, anything comes in mind? Okay, red flags, safety netting, ICE issues, insufficient knowledge, poor structure, time management. Yeah. So these are the common reasons why people fail. The number one is sitting the exam too early. Some people, they rush into sitting it thinking they want to get it out of the way, but then they are not ready to sit the exam. Second one is insufficient preparation. If you're not giving yourself a good preparation, then you can't wing it this exam. Next one is time management. That's a big one, not just in finding time to revise and practice and refine your cases, but also in the actual consultation, to manage your time in the 12 minutes. And we've already talked about one thing to do is a priming of the case. We're going to talk about more ways of managing your time, the consultation, in a bit. Being doctor-centered, that's another issue. Some people I've noticed, especially those who failed the exam before, there is a lack of confidence. Another problem is some people, they are overconfident. They think that they're doing well, and the problem is they don't know they have blind spot. And that could be because you're not receiving constructive feedback. If you don't receive constructive feedback regularly, you might be feeling, I'm doing well, people are telling me I'm fine. And then when the results come in, then you might get like a big surprise. The next one is keep repeating the same mistakes. If you're not learning from the mistake and correcting it, that's a major problem, because then you're not going to improve. And this is where some people, they just stagnate. So let's talk about the causes of poor time management in a consultation. Inception preparation, not keeping track of your time. That sounds basic, but so many people, when they practice, they don't really look at the time. Slow pace. Some people, when they speak, it's a bit too slow. Long pauses, and there's a lot of dead time in a consultation, and that eats your time. Lack of structure. If you're not organized, some people, they have a habit of talking too much instead of listening. So if talking too much, you're talking over your patient, you're not getting much information in data gathering. The quality of your question determines the quality of your history. There are people who ask a lot of questions, and some of these questions are irrelevant, not needed, and that's a waste of time. You have to ask targeted questions. Or over summary is another big one. I've noticed some people, they over summarize, and that's a problem because you're not progressing. Or sometimes people over explain, and you're overloading the patient with too much information. So how do we tackle these issues? First, you have to audit your consultation and identify the root causes of poor time management. And if it is poor priming of your case, then you have to learn how to prime your cases. There will be cases in the exam where you might have 3 or 4 pages of notes to read. And one time a GP trainee told me he forgot to read the last page. And in the middle of the consultation was panicking about it. Eventually didn't pass that station. So you see, priming your case carefully is really important. Second one, get yourself a timer, keep track of your time. Next one is the structure. How do you organize your consultation? It's very important that you understand how to take the history in 12 minutes. Asking pertinent questions, pacing yourself, making sure that you're not talking too much, but you're listening more in data gathering. And by 6 minutes, you have to be thinking about switching to clinical management. Because if you dwell too long in data gathering, you sacrifice your mark in clinical management. And remember, you get more mark in clinical management. Keep your summary short. Your summary needs to be only like 1 or 2 lines. And the best way is to just summarize the eyes. Don't summarize the whole history. And keep your explanation concise. So do these tips help so far? Let me know in the chat what's your thoughts. Can you see any other things that you could do now to manage your time better? Right. Thank you, Suresh. Yep, priming. Okay, great. So we've covered the MLCGP SC exam, the challenges and pitfalls. Now we're going to talk about how to prepare and pass this exam. Let me share a quote with you from Benjamin Franklin. By failing to prepare, you are preparing to fail. So without preparation, then that's why a lot of trainees then they get anxious about the exam. But if you're preparing, you're giving yourself enough time, as many of you today are already planning ahead, then you'll be on track with your exam. So this is Dr. Erbas, who passed his exam with a score of 100.5. And The reason I'm sharing this is because there's a lot of things we can learn from the top scorers. And he was among the top scorers. So what do they do well? The top scorers plan and prepare early. Planning is so important. You have to be thinking about the weeks that you've got, how you're going to plan every week so that you're progressing. Sometimes it can be overwhelming when you've got this objective of passing your exam and there's a lot of issues. So what you can do is break it down in smaller goals and try and put a deadline for each of them. So for example, in 2 weeks, this is what I intend to do. In 3 weeks, this is where I'm going to be at. So if you break it down, it's going to be more manageable. The second one is the top scorers, they develop self-awareness. They understand that they have areas of weakness and blind spot. So your unknowns, there are things that you don't know that you don't know. And that's really important that you understand that, because some people, they don't have that self-awareness and they don't actually do cases to work on these areas of weakness. Third one is to develop a growth mindset. So we've talked about believing in yourself. For example, if right now you're not at a level where you're happy with, it is an opportunity for you to grow and learn. And for Dr. Lawrence, having a growth mindset helped him so much. Instead of looking at it as a setback, he looked at it as an opportunity to make his comeback. And a comeback, he did make it. And now he's working as a GP in London. So the next one is to understand what examiners are assessing. I'd recommend that you don't just read on the college website what the examiners are looking for, but you understand it as well. You digest it. Because if you are playing a game and you don't know the rules, then you're not going to do well. For example, physical examination is not a part in the SCA. It's not assessed. But yet I see a lot of trainees, they're spending a lot of time explaining physical examination, what they're going to do, or they just don't make a management plan, but they hide behind examination and saying, I'd like to see you in the surgery so I can examine you. And once I examine you, then we can take it from there or something like that. And you're not going to get marks for that, you know? So understanding the rules of the game is so important. Now, you can bring a patient in if you feel that's necessary, but you have to make an adequate plan how you're managing this problem. So the other thing is the top scorers understand that feedback is a gift, provided that it's constructive feedback. So it's very important that you're getting feedback regularly and you're reflecting on it. The reason why I say regularly is because sometimes if you're getting feedback, what happens is that you're going to correct it. But then if you don't get feedback afterward, maybe you overcorrect. One of the trainees I've helped actually did that. So he was actually talking too fast. So the feedback I gave him was slow things down, especially when it comes to breaking bad news. Don't want to step in and rush the patient. You have to keep things slow and let the patient time to process it. But then after correcting, he overcorrected it and then had to refine it and then recalibrate. So that's why it's so important you're getting that feedback loop regularly. The next one is embedding good consultation practice and developing your own style. Everyone consults differently, and you don't have to worry about whether your consultation right now isn't working or not. What you should be focusing on is, let me try this and adapt it to how I can use it, and then how to make it work for you. So you're not supposed to just copy what other people are doing, but it should be something that feels natural when you're doing it. Because on the day of the exam, when you're so stressed, all the things that you learned is going to revert back to your usual way of practicing. And that's why if you embed the good practice and make it second nature, then even if you're stressed on the day of the exam, you will do what is natural to you. Is this clear so far? Yeah, okay. So a quote I'd like to actually share with you is something that we really value in our community. We don't rise to the level of our expectation, we fall to the level of our training. So in the community where I have GP trainees, we really emphasize on the fact that it's very important that you don't just expect on the day of the exam, you're going to magically rise to that expectation. You have to put in the work and work smart. And if you have a good level standard, then on the day of the exam, even if you're not 100%, and there are trainees who, for some reasons, they didn't sleep well last night before the exam, or they have some health issues, but they still had to sit the exam and they didn't want to skip it. So they sat it and eventually passed it, even if they weren't 100%, because they were trained to a high standard. So having a consultation framework is very important. And in the consultation blueprint program, I teach this framework and I'll show you how to use it. The first thing is, you see, you have to segment your history with the timeline so you know exactly where you're at. So in the first couple of minutes, it's very important that you get the patient to tell you the story. You know, this is an exam where the simulator, they will have a script and they will have a story. And your job is to encourage the patient to tell you that story. Once you've got there, then you explore the patient's idea, concern, expectation. So you could say to the patient, I can see this headache's been quite awful and it's affected you a lot. Tell me, what did you think was going on? So asking what's their thoughts about it. And if they tell you, then acknowledge that. And then you may ask the next question. So there are three buckets in the data gathering you have to explore: idea, concern, expectation, and try and elicit it in order if possible. The biomedical to make a safe assessment, and then the psychosocial situation and occupation. So sometimes people just say, who lives at home with you? And that's very formulaic. It's not a good question. A better question to ask would be, how has this headache affected you? Has it stopped you from doing anything? And the patient will tell you. And then you can ask, are you getting any support at home? See, it's more in context rather than just saying who lives at home with you, or asking things like some lifestyle question, do you smoke? It's very formulaic. Then once you've got enough information, fill in the three buckets. The next step is readdressing the patient's idea, concern, expectation. This is where you achieve shared understanding. So for example, if a patient has got really bad headache and the cousin actually was recently diagnosed with a brain tumor, maybe they're hoping for an MRI scan. So if we don't readdress the eyes and achieve shared understanding, then the patient, if we try and manage it and say, so you've got migraine and this is what we're going to do, the patient is still worrying about the tumor and whether you're going to give him a scan. So you have to readdress that first. Then the patient will be open to listen to what you've got to offer. So that's very important. So you might say something like, having listened to you today, Mr. Smith, I understand that you're worried that this headache could be a brain tumor, as your cousin was recently diagnosed and you're hoping for a scan. So I don't think this is looking like a brain tumor, because when I asked you a few questions to rule out whether it could be a brain tumor, you didn't have any concerning symptom. Brain tumor normally doesn't present like this, but what you've got is one-sided headache and vomiting, which is more in keeping with migraine. And normally for migraine, we don't need to actually refer you for any scan. But I could discuss with you, if you'd like, how we can manage this and see whether that helps with the pain. And if it does not improve, then we can revisit whether we need to investigate it further. What are your thoughts about this? See how it's more shared? I'm readdressing the eyes, and the patient feels like, even though it's not what they want, but I'm explaining the reasoning so they understand. Okay? So it's very important that you develop that shared decision making. And then you can explain about how to take the medication, and you can explain a follow-up. The red flag is very important, especially if a patient is worried about brain tumor, explaining all the things to look out for and arranging a follow-up. So we go in much more detail in the consultation blueprint, but I just want to show you how to structure your consultation. The next thing is, you know how some people, they just work hard, and working hard is not enough to pass your exam. You have to work smart. And the SCA Companion is a resource that I'd like to offer to you. So you can get this. I will share the link. So at the end, you can actually start using it. What it is a system that helps you to keep track of your progress and document where you're going in your exam preparation. So it's step by step, and you can follow it step by step plan so that you know you're on track. And also you can rate yourself among the 12 clinical experience groups. And every time you're doing a case, you can write it down so you don't forget. Because otherwise, we forget a lot of things. Like if I asked you what cases you did 3 weeks ago, you probably forget what cases you did, let alone the feedback and what you've learned. So that's why if you keep track of it and reflect on it, it's going to be there so that you can come back to it leading to the exam. And this is what Dr. Sunita, who passed her exam, found. She used this, and she was part of our program, and she actually found that this is the best things she actually did, revising and making a note of it so that a few days before the exam, she just read it and it came back straight away. So she knew what are the pattern that she should be aware of and not making the same mistakes. Right. So what was the most helpful idea you learned today? Readdressing eyes, yeah. Yeah, I think case priming is very important. If you prime your case very well, especially for the discussion or results where you have the investigations report, you're going to be ahead. Right. So now what I'd like to do, if I have your permission, I'd like to show you how we have improved the pass rate of IMGs from 51% to over 80%. And I'm going to show you what system that Dr. Lawrence used. Consultation Blueprint is the program that has helped hundreds of GP trainees pass SCA, finish training, and earn more. And this is a tried and tested blueprint so that you don't have to actually worry about trying something and not getting the results you want. It's divided into phases. First, we lay the foundation. If you have got strong foundation, on the day of the exam, if you're actually encountering cases where you don't know much, there's uncertainty, you can still earn some marks and you can still pass. And in fact, in the exam, many trainees have encountered uncertainty where they don't know much, but it's how you respond that makes a difference. So we consolidate playing to your strength and turning your weakness into strength, polishing things nearer to the exam so that on the day of the exam, you're at your peak. And when you sit the exam, eventually you'll pass the exam. So there are three core pillars that we focus on: mindset, strategy, and consultation skill. Most people, when they're learning consultation, they spend way too much time reading books, guidelines. And this is a quote from Confucius that encapsulates how you should be learning. I hear and I forget. I see and I remember. I do and I understand. So if you're learning to drive, there's so much you can learn from a book, isn't it? You actually have to get in the car and drive to learn driving, right? And in the beginning, it can be quite overwhelming. There's a lot of things you have to do. But if you're actually taking step by step, focusing on one aspect, for example, the gear or the steering wheel, parking, do one step by one, then eventually you will get there. And this is what we do with your consultation. So we look at not just your skill, but the attitude, the behavior, so that when you're consulting, it's in alignment. And there's a workshop that I've been running for the last couple of years now, where we demonstrate to you these high yield scenarios, and you can practice and refine your communication skill, boost your score in all three domains, and receive individualized feedback from myself and from our role players. And we go through the high yield scenarios, Prussian dilemma, safeguarding. And this is what one of the delegates who attended the course said. Brilliant simulators, great variety of cases, short and concise. Didn't feel bored at all. Every candidate was given enough time for feedback, which is one of the areas a lot of trainees are not getting enough. And this is Rachel, one of the role players on the program. So the next one is going to be on the 20th of February, and it's going to be from 8:45 to 1:45. There's still spaces available. If you're interested, let me know in the chat. So what you learn in Consultation Blueprint is a strategic plan so you don't waste time. We teach you how to maximize your score, proven methods to manage time more effectively. We go in much more detail in the program. And you will learn how to refine your consultation and communication skills, how to manage medical complexity, manage risk and uncertainty. So when you sign up to the program, you put in your email address and password, and you will be able to access the course. And as you can see, the course is organized in modules and lessons. So each lesson you will learn, and it's something that you can do at your own pace. So you won't feel lost because it's step by step. And there's also case demonstration. There's 30 of them where you can see me consulting, so you can see what you can do to score high, clear pass. And these are cases that many trainees have found very useful, especially when they were sitting the exam. We cover the 12 clinical experience groups, and I also teach in the program how to manage follow-up cases. This is a different structure, so we go in much more detail about the consultation. So if you'd like to join this program, you will get everything we discuss, and also invite to the monthly workshop. I'm going to run one next month as well. There will be the workshop, and you will also get personalized action plan one-on-one with me. So we'll sit down and look at your consultation, your revision, how you're planning it, and how to use your clinic to optimize your score in the SC as well. So you'll get ongoing support from myself and one-to-one constructive feedback. And there will be free one-to-one sessions. And in each session, we go over 3 different scenarios, and you'll have enough time to ask any further questions. It's only £399 today and 2 additional monthly payment. Or if you would like to pay in one payment, then it's £1,099, which is the special offer for today. It's normally £1,200 that people have paid for this. But because you're on this webinar, you get it for £1,099. So there's limited spaces. I'm currently already coaching 13 other GP trainees, but there's still spaces available, especially if you're going to sit in March and later. So if you want to join this program and secure your space, then direct message me in the chat, yes, and then we can actually send you more detail how to apply. This is Dr. Vijay, who actually failed his AKT 4 times. He sat the SC exam once, failed, and he didn't believe that he could pass his exam. But he joined the program, and within 4 weeks, his score went from 65.5 to 86, and now he's preparing for his AKT. So even if you didn't pass AKT, there's still chance for you to pass SCA. And one of the major issues he had was gap of knowledge and mindset as well. You can imagine after failing 5 exams, it's quite like your confidence at rock bottom. This is Dr. Yogini Gokul, who was a gynecologist. She turned into GP, and she struggled with her consultation because, in hospital, you're used to take a longer history. So we had to work a lot on how to focus the history. And she eventually passed her exam with a good score, and she passed it on her first attempt. Dr. Gordon actually failed his exam by half a mark, and it was painful. He sat the exam 3 times already, and he was really devastated after failing the exam because he had one more attempt, and he joined the program, followed through, and we worked through the step-by-step blueprint, and he passed his exam with a score of 87, and now he's working in the south of England. So we've got over 80 testimonials, and a lot of GP trainees have gone through the program and they've got great results. So if you want to join this program, as you have stayed up until the end, I'll give the first person who joined £100 voucher to save, so that it's only going to come down to £999. If you found this video useful, you might want to watch this video in which I go more depth on clinical management. Click the video to watch it. Take care, everybody. Bye-bye.